Hey Mo,
Hey, Ricky,
the doctor is in.
we are definitely in with a topic that is always in season, and it's mental health. This is a topic that we don't talk enough about, in my opinion, in our community, but we want to hear from some experts. We want to hear from a patient sharing her story, and we want everybody in the chat to put your questions, put your comments, share your story, and really engage on this topic because we got to talk about it. October might be done, but guess what? Breast cancer is still very much with us, and all of the challenges that it brings are still with us. So, who are your friends today?
I have some great friends today. Devika, I met like a few years ago, and she's been doing incredible research and from Memorial Sloan Kettering, just like an amazing psychologist, right? And we'll let everybody introduce themselves, and then her colleague Lisa is here today, and then I just met Dr. Monique. Hello, Dr. Monique the other day, so they're great. And then we have our precious Nikki with us, our breasty Nikki. We love you so much, Nikki. So thanks for being here today. So, you guys we'll go around, let everybody give your appropriate titles, and then we'll let Nikki tell her story and get us started, okay? So thanks for being here. Devika, you want to go first?
Absolutely. Thank you so much, Ricky and Dr. Bo, for having me. I am a psychologist at Memorial Sloan Kettering Cancer Center, and I conduct research on access to care, particularly access to care for breast cancer. That includes mental health care as well as state-of-the-art cancer treatments.
Dr. Monique?
Yes. Hi, everyone. Thank you as well to Ricky and Dr. Mo for having us here and for inviting us. And so I also work at Memorial Sloan Kettering Cancer Center. I'm one of the psychiatrists. I see patients both in my outpatient clinic, where I have a specialty in breast cancer patients, as well as inpatient. So I have a few days of the week where I'll go and also check in on any of the patients that have been admitted to the hospital. And in that role, I see patients of all ages and every kind of cancer type who have been admitted. I also have a special interest in education and in ethics and in women's mental health.
That's incredible. Thank you so much for being here. Lisa.
Hi, everyone. Thank you so much, Ricky and Dr. Mo, for having us here. We're really excited. So I am Lisa Menon. I'm the project manager of ACT, which stands for Access to Telehealth. And so I work with Devika and the Immigrant Health and Cancer Disparities Service at Memorial Sloan Kettering. And so our project specifically seeks to address the digital divide for the most vulnerable breast cancer patients in New York City. And we're going to get a little bit more into that as the show goes on. So great to be here.
Thanks for all this amazing brain power. I love this. I love this so much. I love being around people that are so much smarter than me all the time. So thank you so much. So Nikki.
Hi, I am Nikki Carr, breast cancer survivor of a month. I finished my chemo, Keytruda and Xeloda. I did the whole shebang. And I was diagnosed in September 8th of 2021. Initially, it was a blow for me. I did not want to hear anything about it. My sister is a breast cancer survivor, and it took me to very dark places. And I ended up switching. I'm gonna just get straight to talk about the topic specifically. I switched my healthcare providers, and I was able to get the most amazing telehealth therapist. I can't share her name because of HIPAA. Yeah, I'll call her Nikki's therapist. I can only deal with Nikki. And I found her through Therapy for Black Girls, and I felt like, I've been in therapy before for various things, but this one at first, like I said, it was a blow, and I didn't want to do the chemo. I was diagnosed stage 2 triple negative breast cancer, and I was like, oh, boom. So September I was stage 2. By October I'll be stage 3. By November I'll be stage 4. In December I'll be gone. Oh, that works. Because I didn't want to do anything. I didn't want to have to change my appearance and just go through the journey. and it took me to very dark places. And I ended up finding, had a gleam of hope after versing with one of my professors. And I was like, well, I gotta live in order to carry out my dreams. And I had to find a way to navigate out of that dark pit that I had dug myself into. I was white knuckling, trying to crawl out, but I just didn't have the tools. So I went on therapy for Black Girl. I found my therapist, and we meet once a month on Sundays. It's just amazing. Just once a month over the internet, and you know, she worked with my sliding scale for financially, because it was time I wasn't working, and you know, she even sent me a care package as I was recovering from my double mastectomy. I believe that, you know, if men and women that are watching now, there's nothing wrong with therapy. The stigma that I guess in the Black community, we don't want to talk to nobody, I'm gonna figure it out on my own, just like me. But I didn't have the tools. And so my therapist, she one thing that she would always say, you know, I'm recovering from not only breast cancer, but I was divorced and still healing from that. And she would always say, just about in every call, what's keeping you stuck? And so one of the things that I learned, you know, on this cancer journey, healing myself through forgiveness, or forgiving myself, or forgiving others who have hurt me in the past. And if I didn't do that, that was going to kill me, not the cancer. And so she just gave me these tools, and my counselor she's heaven sent. So yeah, that's my story.
Cool. So she saved you. I mean, she helped you do your treatment.
Yes, she did. She gives me homework, and I was like, I ain't in school anymore. Why I got to do homework? But you know, I had to figure out it's not just because she's just giving me something busy work. You know, it was breaking down, chiseling away daddy issues, divorce issues, singleness. We just cover that. We just cover that. Like, what does my life look now as a cancer patient that's single? Single. Hello. Sorry, Ricky. And
I love it. I love
so,
it.
but navigating through that, and she's like, well, let's first make sure that you're healed from your past, you know, relationships and, you know, divorce or whatever. And she gave me these tools. She gave me like a checklist to try and figure out, I want you to think about it this way. Or the question has always been, what is keeping you stuck? And it's a deep dive of me. I'm like, dang, 5 minutes into the conversation, you ain't even earned your copay already. You already coming for the juggler already. So she's
You spicy
yeah,
today, Mama. You spicy. I love it.
I was like, you haven't even, you know, you came right for me. And she's like, yeah, we don't have time. Life is too short. We don't have time to vacillate with you. We need to get to the nitty gritty. And this is what I think, would you consider doing blah, 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 blah. And lastly, I will tell you that, go ahead.
No, go ahead. You talk.
I was going to tell you right around the time of the year that I got diagnosed, I was like, what is going to emotionally, mental, I was just all over the place. And she said that there's this book called The Body Remembers. It's like post-traumatic stress disorder, or post-traumatic cancer disorder, because to me it is PTSD. But he said the body is remembering what you encounter. So what can you do? You got to be gentle with yourself. Would you consider not entertaining the thoughts, but doing something on the anniversary day, so that you won't be stuck in a place where you were last year? Because I can remember now, November 2nd, I remember exactly where I was last year. And she's like, you're doing yourself a disservice remembering. Let's recreate memory, so that your body can remember the good things.
Mhm. So what got you to the council? Like, what made you do it?
Well, I was in class, I was pursuing an MFA in acting, and I had a professor that you know, he was digging deep, and I wanted to earn. I want to win an Oscar, or EGOT, Emmy, Grammy, or Tony. I don't know. And I was like, well, in order for me to do that, I gotta live. So I ended up. I had to do a mental shift of, it's not just getting up, getting dressed, going to the chemo, but it's while I'm preparing throughout the week, or even while I'm there, put in my mindset of, you got to get healthy. And I didn't really have those tools. I didn't know what that looked like other than the physical aspect of the medicine. So it was healing the mind, healing the spirit, healing my will, and healing my emotions. And my therapist, she was like, I need, the very first session, you know, I remember that she said, I need for you to write down the things that are keeping you stuck. I was like, I just could think of two things. She was like, really? So she said, okay, you can start now, but start with those two. But I need for you to do a deep dive. And that whole next 3 weeks, it was uncomfortable. It was uncomfortable. And I think that's why I didn't want anyone to know about my cancer diagnosis, because it was enough for me to say I'm going through it physically, but it was a mental change. So now that I'm on the other side, she's working with me to help transform how I see myself, because I don't look the same. You know, my body has gone through some changes, and my body has gone through some changes. And so she said to me, Nikki, I need for you to look in the mirror, you know, and start writing yourself some letters or whatever, and just being thankful that you're alive. You know, you'll get, eventually we'll work on you getting past that external. But let's start with 5-second breather of, I'm alive. My hair may not be like Rapunzel, and it's too cold to be bald out in these streets. So she's like, well, there's ways, you know.
I
but
got a lot of hats I could send you, girl.
okay, you need my address. I can help you out. No, but yeah, so that's what made me go. It's, you know, starting with seeing myself at the end in the future, what my life would look like. You know, me wanting these aspirations, but I didn't have the tools on how to figure out how to mentally get there besides the physical, you know, the medicine part.
Okay, docs, what are y'all thinking about this? Her story seems, I mean, I don't want to say everybody has similar issues, but we all have these. We're a new me, as I told you about me. Like I lost the me I was, and I wondered when she was going to come back, or if she was going to come back. And you know what? She didn't. A different me came back, or came. I think that's what you're going through now, babe, too, you know? You're finding a
It
new
is.
one.
It is. And I'm okay with that. You know, I get to see how my body is transforming, but it's remembering that now I look at it and I have this port scar. And it wasn't because it was a scratch, or it wasn't because my bra strap was too tight or whatever, or my necklace ripped or whatever. It's not that. It's the trauma.
There it is. There it is, right? Battle scar.
Yeah.
Yeah.
And battles are not fun. Nobody wants to fight. You know, fighting people. Nobody wants to do that. Sorry, Mo. Nobody wants to do all that. So it's a beautiful.
Oh, good. You're not alone in that fight, for sure. But no, it's not a fight that anybody picked. They didn't choose it.
No.
You didn't pick this fight. You didn't start it.
You didn't start it. You didn't ask for it.
Absolutely. You know, Nikki, thank you so much for bringing so much of yourself to us, so much of your story to us. You hit on so many different points, so many different themes that I think so many of people with different kinds of cancers, but especially breast cancer, go through. And, you know, you guys are talking about scars, right? The port scar, you have your mastectomy scars, right? You might have even scars for IVs before the port came in. And
Mhm.
there's something I read, right, about scars. Scars only form on the living, right? So once you have passed away, you will not get a scar. A corpse does not form a scar. Those things that bring scars to our bodies don't work anymore when we've passed away. And so a scar is both a memory, right, of the things you've been through, and also a such a clear, tangible souvenir of still being alive, right? And still going forward and being a survivor. So there is something about these scars, right? I read another thing that said, wouldn't it be beautiful if we can get a scar for some of the happy moments in our lives as well, right? But we always get these scars for things where we've had a wound, where it's been, the skin has been broken, right? Where something has been changed, right, for some kind of purpose. But wouldn't it be lovely if we could also get a scar for some of these other experiences that we have? And so when you were talking about the body remembers, and about how your therapist was saying that, okay, you can go back to November 2nd, 2021 and remember exactly what you're doing. And so what do you have to do today? You have to couple this date with something else, right? It's kind of like you have to create your own scar before a time after treatment, and a time where you're having different kinds of emotions and moods and so forth. So just so much of what you're saying resonated so much with myself and with the people that I see really every day. And so thank you so much for that.
It has to be like a Girl Scout badge. Why can't we do something with, right? Like everything times
We
we
have to make one. We
yeah,
have to
like make a staff and put your badges of happiness on them. We should do that.
Maybe a tattoo, you know, a certain
Yeah.
tattoo that everybody kind of knows with some symbol or something on it, you know.
Yeah.
Devika, tell us more about, and Lisa too, please feel free to weigh in and let's talk about maybe some of the impact that COVID has had. I know Nikki was diagnosed and treated during COVID, this pandemic, and it's really, it's a different ballgame for newly diagnosed breast cancer patients and the way they get their care now compared to 3 years ago even.
Yeah, absolutely. I think I've noticed two trends. One is that the mental health care providers are overbooked. It can be really hard to get an appointment. On the other hand, because of the switch to telehealth, the network of people who you could potentially see for treatment has really widened. So, you know, many of my patients could really see any provider licensed in New York. Some of the regulations have changed, but even earlier on in the pandemic, the state licensure requirements were relaxed, so people were able to get access to more specialized providers in some cases. So I think that continues. You might not have someone locally who specializes in what we call psycho-oncology, you know, psychiatrist, psychologist, social worker, other mental health provider who specializes in the psychological sequela of cancer. So even if you don't have one kind of in your backyard, if there's someone else in your state, you might be able to connect with them. Or in some cases, you know, I think both of you are sort of talking about how some of the issues that come up, they're related to the breast cancer, but sometimes they're things that pre-existed the breast cancer. And so sometimes it can be helpful to get access to someone who specializes in a different issue, and your network for that is wider as well. So, and I'm certainly hoping that that's something that's going to outlast the pandemic. And that's why I've been doing so much research on making sure that people have access to telehealth so that they can take advantage of that broader network of providers.
And go ahead.
No, you go.
I was gonna, another great thing about telehealth is we've seen that it can really mimic as well as it can you being here in my chair, right? So we can still build rapport, we can still build a connection, we can still build a relationship, right? I think Nikki can attest to this with her teletherapist. And for some people, it can actually quite blossom some of the exposing nature of therapy. So they might be able to talk more, actually more easily with the screen that they could in person. You know, for other people, it's different, and that's okay. But we always say to try it out, right? Some people tell me they're a little nervous about starting at first, but to do those first few sessions and see what it's like.
You can have on your pajamas. You don't have to go out of your house, right? So I don't know.
And I think social media is sort of showing us. People say a lot of things on screen and behind screen, and they'll type things that they won't necessarily say in person. And when you're talking about a therapeutic situation, that can be empowering. I wonder, do you have any instances where people are putting on airs and trying to be a different person, just like we do on social media, right? We want to put our best foot and our best face forward, and always forward facing with only the good things, right? How do you break down some of those barriers and get to the real, Dr. Monique?
Yeah. Well, I will say that people do that in person or on the video, right? And some of that is an example of coping, right? Some of that is an example of strategies that people develop over their lives, cancer or not, just how they move through the world, right? And so I think when we start our relationships with the people that we see, there's always a little bit of that veneer of that how they want to present themselves to us, right? Sometimes people will actually say, I want to be a good patient. They will actually say those words, right? And so it's really my job to first understand what they even mean by that, because that means something different from to everyone. And also these kinds of things, if they are kind of putting up a veneer and so forth, first of all, what are the pros of that before we try to break it down, right? Why is it there? Why does it exist? Why does it help them in life? And so I have to understand that first, so that then we can talk about what would it be like to strip some of that down. But such a normal thing to happen.
So you guys, I really believe that stress played a role in my cancer. And so when Nikki started talking about other stuff she was dealing with, her divorce and, family stuff or whatever, stuff she had to sort of unpack. I had a lot of stuff too that I hadn't unpacked that I didn't realize I could have used help with before I was sick. But, I still wonder, I think so many Black women have so much stress that it's causing cancer in our lives. We're internalizing this stuff. I mean, that's a whole
How do
nother
we
conversation,
quantify
but-
the impact of stress?
Yeah, I
Oh,
know.
sorry. Go ahead, Nikki. You want to chime in? You go first, please.
Yeah. I was gonna say I had gotten a clean bill in June of 2021 mammogram, and my ex-husband and I had an intense conversation. I was seeing red, and I promise you, because I was in July, by August I felt this like electric shock coming, and it carried on. I was so angry with him right up until the time I found out about it. I was like, well, where did this come from? It was a pea size. It wasn't there in June. And I think, it's the stress, it was the anger, it was a lot that I encountered. And I was like, well, maybe I hit it because I was moving. Maybe I hit it from the box. So maybe I hit up against a wall. But it was like, whenever I talked to him, I would just get so, and I was like, that's stress. I need to let this go. We're in a better place now, he and I, but nah, I had to let it go. And then also to speak to your point, like I would get up, brush my teeth, and try and put on makeup and stuff, put on airs. Like, this lady can't smell me. Nikki, get it together, So I did try and put on this air, like by the end, the makeup was all cried out. So just present your authentic self, want to roll out of bed just right before you start, just do that. Just show up and show up to the table and just be yourself. They don't care what you look like, what you smell like. They just want your authentic self there. Be honest and open.
Lisa, you're looking very pensive over there.
Yeah, no, I found this conversation to be really interesting, and thank you, Nikki, for sharing your story. I mean, it's really a compelling one. But I also just was kind of thinking about the patients that we've kind of seen through our project. So we do run out of MSK, but we also do clinic outreach and recruit at a lot of the food pantry program sites that our service runs across multiple New York City Health and Hospitals facilities. So the public hospital system in New York City. So since these pantries are designed for food insecure cancer patients, a lot of them are already at an economic disadvantage and have multiple other stressors in addition to their breast cancer. So they have a lot of needs like beyond telehealth. So whether it's, they need food assistance or legal assistance, like financial assistance, transportation, whatever it may be, there's all these kinds of things that are kind of adding to the current health situation. So because we focus on telehealth so much, we also try to make sure that their mental health is being looked at as well. So we kind of offer a lot of referrals to mental health counseling, whether that's like therapy or support groups through a lot of our community partners. And we find that that really helps a lot of patients. And we actually have a lot of Spanish speaking patients as well. So we try to like have programs and kind of link them to programs that are both culturally and linguistically competent as well. But we found so far that it's really been helping a lot of the patients when we've been doing like follow-up surveys and kind of just like checking in with them and seeing how many of them have actually used our resources and have kind of looked up this sort of like health information and connected with peer support groups. So I think it's been a really important facet that is important to look at.
That's great. We have a navigator friend in Oakland, and she works in a pretty, community hospital. And she says that before she can even have the breast cancer conversation with her patients, she says, where are you going to sleep tonight? Where are your kids? When was your last meal? So she's dealing with all these other things before she even get to the chemo.
Exactly.
Right?
True. That's
And
true.
we're seeing that so much. I mean, I actually had 2 calls today from breasties who are in treatment and say, I can't pay my rent.
Yeah.
I just can't do it. I can't work. I can't do it. How can you help me? And thank God we have some resources we can send them to, but just living is hard. And then when you add the cancer to it, there's so many things that just complicate life, and just being able to take care of yourself, right? And then I think there's also, for me, it was about, I'm not who I am. I can't cook dinner. I was a cook for every holiday. I did chemo the day before Christmas Eve, 2 Christmases in a row. So we had no dinner. Amanda tried to really cook on, it was like we couldn't eat it. So it's like, but I mean, the whole concept of cooking Christmas dinner was a thing, and I couldn't do it. And I didn't know when I'd be able to, right? So, I mean, all of that that's a stupid thing that I want to cook Christmas dinner for 30 people, but I couldn't do it. And it really hurt me, or really upset me that I was unable to do it. You know what I mean? I didn't have the capacity to do it. And I think that happens to all of us, right, Nikki? I mean, not being able to be who you are. So
I agree.
Good.
It had taken, so much from me, like my career, also just trying to get back, currently now trying to get back into auditioning. And it's the mental block of, I'm seeing myself on camera and I want to say, hi, my name is Nikki Carm 5'6", and I don't like the way my eyebrows look. I have to draw them in, or I have the chemo did stuff to my skin. So it's the mental thing of, getting past this block that I've created. It's just, I think I've put myself in this mental space of being stuck. And, if I could just get past it, I'm getting past it, being gentle with myself.
That's right. be gentle with yourself, be kind to yourself. And, you know, of course, right? We all have a hand in how we see things in life, challenges, successes, yes. And also to be kind to yourself about, you know, the fact that you did not put yourself right here, being a cancer patient, right? That the chemotherapy and the surgery and the radiation, right, depending on who you are and what your treatment was, has real consequences to our bodies. Our bodies and brains are beautiful, beautiful things, but they are fallible, right? And they can take a hit sometimes, right? And so it is this balance that I think all of our patients have to strike of, you know, the acknowledgement and the kindness that this chemotherapy or this hormone therapy, if you're still taking that, is still in my body, causing fatigue, causing brain fog, causing sleep disturbance, causing irritability, causing anxiety, causing depression, right? And the acknowledgement that this is here and that I can use my resources, that I could reach out, right? And also that I could use these coping strategies that hopefully everyone has a handle on to help as well. But it's the both. It's the both that really has to, that we really have to, I guess, prioritize both ways of thinking about that.
Really agree. And Nikki, I have a question. I'm kind of curious about how you sought your therapist. I mean, what brought you to the website that you use? How did you decide you wanted to use that resource to find someone? How long did it take you to get an appointment?
So I don't know. I think Big Brother was listening, and Instagram or Facebook just popped up and said therapy for Black girls. I was listening. Do something about my student loan, and consequently they did. And so I went on. It was like sponsored advertisement on one of the social platforms, and I went and I looked. I wanted a woman. I wanted someone around my age, and so I could do these filters throughout the app. I think I still have the app on phone. But it was, or the website or whatever, and you could do these filters. I wanted someone near me. So I was thinking, even though we were in COVID, would I be able to go see them with a mask on, or would they be amenable to that? And or I was always open for Zoom, or what do you call it?
Virtual.
Telehealth.
Virtual,
yeah.
virtual telehealth. So when I found the lady, I was living in Athens, Georgia at the time at school, and I saw that she was maybe about 40 minutes away from me. So if I needed to see her, then I could go. But then when I reached out to her, and then she had Sunday hours, I think that was good for me because during the week at the time I was in school. And the weekend, Saturday, I had treatment on Friday. Saturday, I was kind of recouping. Sunday, I had like a burst of energy, so I wanted to see her then. And I love that it was something about her website. It was just her introduction. It was warm. She had dreadlocks, and I just lost my sister locks when I met with her. And it was a website. It was her introduction, and I noticed that she took Better Health. That's the type of insurance, or she took Beacon Health, and I noticed that she was on my insurance through the Screen Actors Guild. I was like, that's a rarity. Okay, so this is meant to be. And she worked with me when she and I conversed. She was easy to navigate. She sent me the link. I signed up on the website, and then she sent me an email, and then she said there's time for us to talk, and then we talked for a few moments, and then she sent me the paperwork and was like, hey, send me your insurance card. Everything was, it was easy to do. I could have done either the thing on my phone or either on the computer, but I think it was easy for me to manipulate, to enter my information, upload my picture, my insurance card from my phone. She made the transition smooth, as opposed to me having to track down. You know, I did try to see some other people, but they didn't have availability immediately. Or they were at this location on this week and then that location now, but they weren't taking new patients at that location. It was just, I just felt like she was having sense for me. If she could deal with all of this, you know, that's what I think. Yeah.
Yeah,
I
no.
think you brought up some obstacles though that telehealth solves for, right? Is that what you're gonna say, Deepika?
Yeah, and I mean, particularly, you know, the issue that some people really want a mental health care provider who shares some elements of their background. And that can sometimes be difficult to find very close by. So, you know, that was why I was so curious. And, you know, and I think Lisa sort of alluded to it too. We try to at least give people referrals for the option of someone who speaks their language, or someone, you know, who might share their culture, or a support group where people might feel at home if that's something that they want. And I think that's one of my favorite things that has come out of the wider use of telehealth.
I think it's great also that your therapist actually was open to seeing you in person in the office as well. Because that's something that we've seen with like a lot of patients who we provide them devices if they're eligible and if they need a specific device to perform telehealth. So we've given about like 195 so far, but one of the constant concerns is whether they have a space that's private enough for them to do any sort of telehealth. But especially if they're using like mental health via telehealth, that's a huge like obstacle that we've kind of encountered. So I think it's great that your therapist is actually open to both, or it's like a hybrid model. So I think that also is like a potential kind of like leeway to having more people access that as well. Just having that option available.
Definitely. I think the other things about telehealth that are kind of interesting. So this part about having a private space, right? Especially for, you know, mental health sessions, which are usually either 30 minutes or maybe 50 minutes long, right? Depending on the kind of therapy that you're getting. It can be hard to have a private space for 50 minutes, right? And talking about the pandemic, so many people were at home together, right? And so it used to be that maybe you could steal away for an hour here or there, but how are you going to do that when there's 6 people at home at all times? So, you know, not saying that I'm recommending this one way or the other, but I've had sessions where people were in their closets, in their bathrooms, and staircases, right? And in outside in their cars, in the park sometimes. And so there's a few tips that we give before you log on to a telehealth session, right? The first is what Lisa and Devika have been talking about is access, right? And if you need help with access, to really reach out to one of the programs. Of course, the ACT program is definitely one of these programs. So the first thing is do I have a device that works, right? And we do kind of advise for you to try it out, right? Do I need headphones, right? Does that help? Do I need a different kind of Wi-Fi server, et cetera, right? So first is just trying out the device and internet. The next is finding that private space that you have, and you know, we also talk about how sometimes in a lot of communities, but especially communities of color, sometimes we tell people that we have that we're going to see a therapist, and sometimes we don't. Even in the time that I've been practicing over these last almost 13 years now, right? There's been a big change in that, which is really lovely to see. There are more people talking about it, right? There are commercials now. There are celebrities talking about seeing therapists, and of course that's music to our ears, right? Myself and Dr. Judika. We love that, right? But for some people, it might not be, they might not want to be as open just yet, right? And we're here to kind of support either way, but nevertheless, to get a private space, also to not be afraid to ask questions of the person that you're talking to, right? To the therapist, to the doctor or mental health clinician that you're providing, whether it's questions about the actual therapy that you'll have, or even like best practices with you and the other person. Ask about the timing of things, right? Ask about things like cancellation policies, this kind of thing. So questions, questions, questions. And then it's also pretty common in the mental health world that you might have to reach out to a few different people, right? Not only for availability, but sometimes about who you connect with. So also don't be afraid to do that.
Love that. Can we talk about that? Finding that good and that right fit, what feels right, and maybe when it's time to look elsewhere. I think we have a similar conversation about second opinions and in cancer care and treatment and that sort of thing. How does one, what are some criteria by which someone can maybe gauge how things are going?
Well, as I think someone mentioned before, right, there are different kinds of therapy. So it's hard to say that one is really better than the other. So I usually don't talk about the kind so much, right? But when you're talking to a therapist, I think the first thing is, are they listening? That's the biggest thing, right? Do you feel heard? And not exactly understood, because understood might happen in 3 months or 5 months as they get to know you. But do you feel heard? Are they asking questions that are trying to clarify your experience, right? Of course, it's two people in a room. And so I'm going to have my own experiences that might be very similar to yours, right? But am I leaving space for you to tell me about your experience, right? So listening and heard, right? Different than understanding, which comes. And then clarifying questions, right? We have a term in psychology called clarification or clarifying questions. Am I trying to ask a question of you that feels like I'm trying to get at a better understanding, right? Some people say, what about humor? What about personality and stuff like that? Use your judgment. I would say some of that is a little bit secondary, I would say, to listening and to being heard. Some of my, in my personal and professional life, ask me, well, what if it feels like I'm having, like a coffee or brunch with a friend, right? It's hard to say this, right? Your therapist should be your friend in your head, for sure, right? But it should feel a little bit different than brunch or coffee with someone, right? They should really have space for you in that room. The focus of that, however many minutes, should really be you. Very different, right, than in a brunch or a coffee. So sometimes I'll also use that kind of analogy.
Yeah, I totally agree with what Monique has said. And I would also add that if you're having concerns, I would encourage you to bring it up with the therapist and give them a chance and see how they respond, because their response may also give you some information about whether it's going to be a good fit.
Definitely.
So she shouldn't or he shouldn't be your friend. It should be therapeutic in some way, right? Giving you
Exactly.
something that you wouldn't get from a friend, maybe, right? Because it's hard to know, and
And getting homework, right, Nikki?
getting homework.
Were you expecting that from your therapist? And did you feel like
Not at all.
my therapist gave me homework too, and I was like, "Why do I have to do homework? How do I get there?" And it was so helpful, and it was necessary. The work and the questions outside of that session, right? The work happens outside of that session many times, don't you think?
We went past the keying and how you doing, and it's like, okay, so I need this back by the time when we're meeting, I want to see it.
That's right. That's right.
You're
It-
like, really? Right.
And you guys are so right, right? So much of the work has to happen outside of the session, right? So Nikki sees her therapist once a month. I see a lot of my patients once a month, some once, well, actually a lot once every 2 months, right? Every 10 weeks sometimes.
Wow.
And even the most frequent therapy, which is psychoanalysis, is just 4 times a week, right? So what are you doing with the other 124 hours of the week, right? And so much of the work, whether you're seeing someone so frequently or a little more spread apart, really is what's happening outside a session. You know,
Wow. Okay.
I did want to bring up a couple things. One is, what is the best time to reach out to mental health clinician, to a therapist along this cancer journey? And I think we'd all agree on this call, anytime, right?
Yeah.
If you feel like you could use some support, or as I've heard Ricky say before, we really believe that it's part of everyone's cancer care.
Right. It's your
We're
care
trying.
team.
Go ahead, Ricky.
No, so your care team, when they say, here's your surgical oncologist, here's your, radiation oncologist, here's your medical oncologist, here's your therapist.
Yeah.
Here's your
it-
nurse navigator, should be part of
You're
the
right.
setup.
It's a devastating moment, and it's hard not to imagine how therapy could be beneficial throughout that journey, just to help you even hear and digest what is happening and what your treatment options are and all the other things, and how do you put it in the
Yeah.
context of your life, because you're
Yeah.
thinking about your kids, your vacation, your time off, your all these other things and all these other people that you're caring for and all the other balls in the air, and you're wondering what to do about all of that, and maybe putting yourself even in last place. I'm watching my patients actively put themselves in last place
Oh, yeah.
again, despite
yeah.
this diagnosis, because life hasn't stopped just because you have a cancer diagnosis. You still got a zillion other people depending on you, and how to conceptualize all of that from the very diagnosis, I think, should be an essential part of care.
Yeah, and again, and Nikki was fortunate, I was too, to have insurance cover it. But what if you don't? What if you don't, and you can't afford it, So I think Deborah could just put a link, we'll put a link into the chat for that. I'll put it in there, Mom.
You know, I saw a basketball player. I can't think of his name. He just donated like a lot of money, like a couple of $1 million to for those who had never been to therapy. I think it was through Better Health. It was something. Did you see it?
Well, I'm thinking it might have been Studemeyer, that guy. So he is famous for being a very big mental health support advocate. So I'm not sure, I didn't see what you were saying, but he comes to mind because he's been so open about his psychiatrist and his therapist. And so I wouldn't be surprised if it was him. He actually quite famously, they won the NBA finals, and the newscaster said, "Who would you like to thank?" And he was like, "I'd like to thank my therapist." It was one of the first,
I love that.
first things that he said.
I love that. I love that.
So it could be him, but so some
Paul
of the,
George.
great. There's another one. That's great. I'm going to add him to my list too.
Right. So do you think there's still a stigma about mental health? I mean, in our community, like, did you tell anybody about your therapy, Nikki?
I didn't tell anybody about the diagnosis.
You didn't tell about your cancer for a while. That's right.
Right. And then
I don't know how you
when I
did
found
that.
I didn't go on social media. I only told a couple of people. At the time, my face was very recognizable. I'll just leave it at that, from a job that I'd done, and I was like, and so my train of thought went away that quickly. What were you asking?
You didn't tell anyone. You didn't tell anyone that you were doing therapy.
Oh,
Stigma.
yeah, but I
Yeah,
didn't.
stigma.
I just think, and I didn't want to tell anybody. Well, people
Yeah.
knew. Some of my friends, they knew that I was in therapy. Just for
overall.
maintenance, just
Yeah.
overall. But for that, no. and and I had made the big announcement that I was going through chemotherapy that Sunday that afternoon after I'd had my session that morning. And I was like, you know what, my therapist thinks so. I'm gonna just play this because they never know who I'm gonna help. And that's when I decided to break the news.
Mhm. I can't remember who I told. I don't think I was embarrassed by it. I just had all these other things going on. You know what I mean? I was pretty vocal about everything. I wanted everybody to touch my tumor until I got it taken out. Like men, women, I didn't care on the street. Feel this. This is what cancer feels like. And they're like, okay, Ricky, TMI, but I want you to know, I love you and I want you to know if this happens to your wife or whatever, like feel what this feels like. But I shared a lot. It's a tough one though.
It is, and I think that letting people know that there are resources and that there are resources to reach them wherever they are is one great thing that really did come out of the pandemic. And hopefully we'll see that, continue, because I think all the studies show that the incidences of anxiety, of depression, of everything that was sort of bad got made worse as a result of the pandemic. And we're seeing that on the cancer side of things too, advanced disease, people with a lot more health issues. And it's going to take a community and a village to really help people get through what they're going through. So I'm loving that you all are sharing these resources and we're putting them in the chat.
Yeah.
Because folks really do need help and support. And we saw it during COVID again, when you lost your job, you lost your insurance, right? And it just put an extra strain on people. So as we start to talk about coming out of it and what that looks like, being able to know and just I think it was Devika who put in the chat, you can always just ask your therapist, do they have a sliding scale, right? And that's so powerful.
Yeah, absolutely. And, as far as the tools go, Lisa, I believe that there are also some national resources that people can go to help cover the costs of internet access and places where people can look to get devices, right?
Yeah, that's actually just what I was about to mention. So a lot of folks,
Devices, if you would. I'm sorry. Can we talk
sorry?
about what that means? Devices.
yeah,
What do you
absolutely.
mean by
So
devices?
our program actually provides devices to the patients that are eligible and need a device to perform telehealth. So that would be smartphones, tablets, and laptops. And so we were actually really lucky because MSK's
Excellent.
IT department donated a bunch of laptops and phones to us. So we've been giving those out, and then we purchased additional tablets. And we also have facilitators at the project who speak multiple languages. So they basically will do one-on-one training with all of the patients that we've given devices to. Because I think another thing that I was going to mention is that a lot of folks that want to do mental health or any other sort of health appointments through telehealth is they're concerned that maybe they're not tech savvy. And so we actually will sit with them one-on-one and kind of go through the entire process of how to use the patient portal and how to connect to different resources to connect to Zoom and whatever system that they might have to have any sort of virtual health appointment. So we do that for mental health as well if they're going to be doing that. But again, as one of the crucial things that you need even before you start doing any sort of telehealth appointment or contemplating that is obviously a good Wi-Fi system and the good infrastructure to actually be able to complete these appointments. So a lot of people have issues paying for their internet bill, or they don't have internet access at home at all, or they need help paying for their cell phone bills. So we kind of address that as well and help them and connect them to resources such as the Lifeline program, the emergency broadband benefit, the affordable connectivity program, which is actually really a resource that we count on a lot through this entire thing. And that's all of that is available nationally. So that's a great resource that we've kind of been referring all of our patients to as well if they need help. Just kind of paying for the background infrastructure to set up any sort of telehealth or mental health appointments.
You're giving us so many
Okay.
resources we're putting in the chat, but yeah, you know, sometimes you're a single mom. This is your
Yeah.
computer for the household.
Exactly, yeah.
You got 3 kids doing their homework on it. So to be able to have that resource is really great. It just takes one obstacle off the table to be able to have access to technology to do these calls. And gosh, you guys, a lot. But what you guys are doing in New York, I wish we could have it everywhere, you know, and just have, you know, we should.
And that's a
probably-
good question. What makes it scalable, and what do you think it would
Yeah.
take to be able to reproduce this in
Yeah.
other cities?
Yeah.
And is it possible? And is it? I guess it is. But give us some hope. People who are watching in their cities and their small towns, and they're like, okay, but I don't live in New York. What hope is there for me? And I think there is a lot of hope that's come out of this sort of burst of telemedicine.
Yeah, definitely. I mean, I think so. I've been going to a bunch of different conferences with or different organizations that are doing telehealth, kind of their own sort of model of this, but without the devices. So I think what the fact that we actually give out devices is one of the things that make us unique, and especially this since we're geared specifically towards breast cancer patients. But I do think it would be great to expand it on a more like national level, which, you know, I don't know if we're going to look into that right now, just because we kind of kicked that into full gear in January, which is when we got our full staff and devices and everything and started really going into full gear. At this point, we've reached about 520 people to see if they're eligible for telehealth. And we also designed a custom survey kind of asking about their specific telehealth needs and their essential needs. So like things like food insecurity, housing, other sorts of like financial things that they would need. And so far about 240 people have completed that. So we kind of want to see how we can grow this within
Mhm.
New York City at first to people beyond breast cancer. But it would be great to, you know, hopefully expand it beyond that. But the good thing is that a lot of the resources that we provide to patients are also available nationally. So a lot of the organizations that we partner with, so Share, I think someone mentioned that before, the Red Door Society, Karen's Club, which is a new partner that we just kind of forged a relationship with, thanks to Ricky, actually. So thank you, Ricky, for that. And we were recently
Karen.
featured in their the newsletter for October. So that was great. But they have a lot of resources and they're available nationally. A lot of the peer support groups that we've offered are available nationally. And of course, all the emergency broadband benefits and lifeline programs and other things to get, you know, free or low cost internet services and phone plans.
Well, if you're virtual though, why can't I do it from Maryland? Is there like a state law for doctors or something?
Yeah.
Okay.
Yeah. Typically, your therapist has to be licensed in the state where you are at the time of the session. Some of that was relaxed during the pandemic, but I think that's generally
Yeah.
what
Okay.
to think about. But one
That's something
thing,
we need to change.
yes.
Right?
We would agree. And that's, you know, that's a struggle that's been going on for a long time. And we are certainly hoping that after the pandemic, you know, there will be more steps taken in that direction, but it's been very difficult to see major progress in that area. Yeah.
I mean, that's a huge thing that would free everybody.
Yeah,
Yeah.
and some of that would be helping, but some of it is too, I should really know the laws in your state if you have a psychiatric emergency, for example, right? So the states that I'm licensed in, I know the psychiatric emergency laws
Got
there.
it.
So
Okay.
some of that too is about that.
I was just going to add that as we've been developing this program, we have learned about some similar programs happening at other medical centers. So ask, it's like anything else, ask. If you don't ask, you'll never find out. So many times in these huge medical
Right.
centers, there are programs going on, and if you don't have someone navigating, you never learn about them, or if you don't bring it up, you're not offered it. And I think that's an area where there's definitely stigma. People have a lot of concern about bringing up, you know, difficulty paying because they're worried about the consequences. But there are programs that exist. So ask the nurse, ask your oncologist, ask the social worker. There might be someone who can help you get access.
You are the CEO of your own health. We tell people that every week.
Mhm.
Ask for what you need. And that's a lot of what we teach with everything we do is like, it's okay to ask.
Yeah.
You know, no is never the answer. It's always how. We're going to figure it out and we'll help you. If you need help, call us. We'll
So,
send
you
you,
know,
we'll help you.
sorry, Ricky, to cut you off. I was just going to say most cancer programs, I know ours included, have psychosocial distress meters and other sorts of ways to gauge how people are doing and what you need. And if you just say, check, everything's okay, everything's good, you know, in our tumor board, we go down the list of what a patient's needs are. And psychosocial support's always one of the things on the list. And then the social worker say, well, they scored a 3 on the distress scale. Meanwhile, you've got a new diagnosis, you're single mom, you got 10 million things going on and, you know, 99 problems, and now breast cancer is one of them. And so really do be honest and reach out, because you'd be surprised about the resources that can be available to you. And you know, through advocacy groups like Touch, it makes it that much more accessible for you. And through the organizations that we put in the chat, and this program that you guys are running is just, it's amazing. I wish we could see it in every city.
I know. Amazing.
Hmm.
Amazing. Whoa. Thank you guys. Thank you, my Nikki. Love you, my
You're welcome.
breastie. Love you, my
Love
breastie.
you too.
Yes, we
Thank you,
do.
ladies.
You are
Thank you, doctors.
beautiful.
You guys are
Inspirational.
awesome, so awesome. And you gave us so many resources in the chat, and let's talk further about that, because maybe we can do an article for Black Doctor about some of the resources that you guys have, and like make that kind of put it out there in social media for sure, and make sure people know what they can do, that there are, I mean, there's something for everybody. So we'll help you find it if you can't find it on your own, but don't suffer in your own head. You know, I used to say, I'm talking to the voices in my head. Like, get it out, you know, get it out. And we so easily go into that space where,
We do. Yeah, we live in our heads, and you know, cancer is it's a journey that
Right.
you're on by yourself, but not by yourself. And
No.
I think the more we recognize that, and we're willing to acknowledge that and reach out to the resources that are available, the more available those resources will become. So we thank you for sharing all this beautiful information and beautiful
Yeah.
energy with us. And
yeah,
Nikki, it's good to see you and see
You
that
too.
smile. Yep. Well,
you.
we hope it's been relatable and reliable, real. That's what we set out to do every Wednesday night here on blackdoctor.org. And we're so thankful for the platform to do it.
Yeah,
Thank you to
so
the guests.
thankful.
And we got all the links and everything in the chat,
Right.
but we definitely want to come back and do a part 2 and discuss this some more. And
Yeah, we'll do
and
that,
let's
yeah.
get people free for sure.
Yeah, get people free. Yeah. And thank you to our sponsors. Thank you for all we're so grateful for everything you do for us. And thank you, Black Doctor. And we'll talk soon, you guys. I'm
You
going to reach
got
out.
it.
All
Breasty
right.
love.
Breasty
The
love.
doctor's in.
See,
Breasty love.
Everyone.
Doctor's in. See you next week.
take care.
Bye.
Take
Bye-bye.
care.
Bye.